now a very disturbing story. Shocking revelations coming from the Mahikeng Provincial Hospital in the northwest. The Provincial Health Department is now investigating alleged incidents of newborn babies being placed in cardboard boxes at the local hospital. This came to light following a Facebook post showing newborn babies wrapped and placed in brown boxes. Let's get some answers. We're joined now by the Northwest Health MEC Madoda Sambatha. Thank you so much for your time, MEC. We do appreciate it. What is actually going on? How was this allowed?
Thank you very much for hosting us. First, this incident of putting babies in card boxes, it's not allowed. And there's nowhere in any procedure where it's approved. What had happened is that on the day, which is Saturday, 56 babies were born. They were not born on the same time. Gradually, at 11, they became 56. What was available was 47 incubators and cribs. This is a problem of management. How would a manager of a ward who knows on the day they only have 47 incubators and cribs does not make prior arrangement before they are all full? What we only are happy on as a department is that all 56 were born without any incident of either a baby dying or a mother being affected. But the fact of the matter is that putting them in card boxes will never be accepted by any procedure, or there would never be any reasons to motivate for that.
So, MEC, what I find disturbing, and I'm going to ask my team to just keep those visuals up of those boxes. Those boxes are perfectly cut out. You can actually see that someone took the time out to cut those boxes into a shape of a possible baby crib. So this thing of the fact that there was poor management is not acceptable, because if you know that there were only 47 baby cribs and 56 babies were born, how did you have time to cut out those boxes and not have time to source additional baby cribs?
I agree entirely with your question. This is but one element we are investigating as to how this incident panned out. Was it planned that we will do this? Because what has failed practically, as you check, it's the line management. Those that are delivering babies and those that are managing the ward could not properly communicate, because the ones who are delivering babies are not linking with the ones that are administering the people who must be delivered. Delivery then overshadowed the process that these ones who are managing should have done. What is even worse is that it appears like in the province there was enough, because when I said, now that there's a shortage, can there be a mobilization of extra to be sent there? 18 was sent there in less than 3 hours. And the only problem is that this whole fiasco could not be reported to the CEO of the hospital by those that were involved. It's worse that a doctor they requested to do down referral to create space, they never said to the doctor, we already have extra, and those extra are in the card box.
This is just absolutely shocking. It's completely infuriated me, and I'm sure the mothers that had to see their newborn babies being placed in cardboard boxes, how they felt. Are these babies now in proper incubators?
All the babies are in proper incubators. We also intend following up on families. so that the department has an explanation to them of the incident and then assure them of the actions we are taking as a department. The reason I said I won't end with the form, I need the full investigation on the operations of that unit, because it appears like there's something wrong that is happening there. This incident became a tipping point only on the basis of circulated Facebook. Imagine this happens on Saturday. The CEO is only aware on Thursday just by seeing the circulation.
So, MEC, what are you going to do, or what have you done so far, and what are you planning to do moving forward? As the accounting officer, as much as the CEO also needs to account, what are you going to do as the MEC, given this was allowed to happen and these babies were put in cardboard boxes?
What has been done now, the hospital has enough cribs and incubators. Secondly, those that were involved in that incident on Saturday have been put on precautionary suspension. Thirdly, the report of the investigation will be ready by Tuesday. Fourthly, I have already spoken with the HOD of the Department of Health. They are finalizing appointing a task team of specialized people in nursing that must do the whole investigation as to the process work of that unit as to what are the problems. From that, we will then fix everything that the department has to fix. But like you are saying, people must account in the meantime. The only weakness that we have in the system is that the people who are dealing with all this process could not relate the information to the acting CEO, nor relate to the CEO when he was back. But the worst component is that the manager who was phoned by those at work did not go practically to the hospital.
Okay, MEC, how many people have been placed on precautionary suspension?
Now is two. Is the manager who was available on the day on site, and then the nursing manager that got the report who did not relate with the report to those above her. That's why the department was not aware.
Okay, MEC, I want to ask you this question. We've heard many times before about nurses being subjected to the worst conditions in public healthcare facilities, not having enough resources, working in very difficult conditions. Is that at all the possibility that could have happened at Mahikeng Hospital? I know you're saying that they knew that there were going to be 47 babies that were supposed to be born. Yes, 47 babies that were supposed to be born, and it ended up being 56 babies. But is there all a possibility, and are you aware of the challenges that many nurses and healthcare practitioners face because of the challenges in public hospitals?
In relation to this case, we will rely on the investigation as whether there was any shortage. But when I met with them yesterday at 6 in the hospital, they had said to me they tried to order both cribs and incubators for 2 consecutive years. It's highly impossible that people cannot be able to get a crib. It's not even expensive. Highly impossible. But whenever the issue has to do with support and availability of resources, I'm always in public saying, whenever our own nurses or anyone who is involved in our work is exposed because of the shortage that the department has caused, we must be informed, because we are not directly running the service. In this instance, that's why we did not go to the nurses and doctors who were delivering. We went first for the first line of management. Let them prove that there was a frustration in terms of resources. If that's proven, we will then deal with that on the basis of consequence management. Okay. Otherwise, if nurses and doctors who were involved in this safe delivery of our babies, we're frustrated by so shortage of resources, we'll never run away from that responsibility as a department.
Okay, lastly, MEC, I've completely run out of time, but I have to ask you this. There are reports coming in that people are being turned away from clinics and healthcare facilities in the Northwest because facilities are unable to keep up with the medicine demand. Are you having a medicine shortage? What is the challenge around that, and why are people being turned away when they are in desperate need of medicine?
The reason in the budget speech I had said that we are going to introduce a toll-free service delivery call number is exactly to cover that, because it is not expected that anyone whose medicine is not available must be turned down away without proper referral. In the medicine space, we do have a time shortage because there's national shortage. At times we have shortage because there's provincial shortage, but critically, we do have a management problem even on that one. I still don't understand why an operationalness of a clinic would not do stock taking for the next day, so that when they knock off, they are sure of what they are supposed to have the next day and what they don't have. In this instance, there are others whose shortage has replacement, but there are others whose shortage has no replacement. As we are launching the toll-free number, we want to say to our people, whenever you are referred back, it must be the facility that calls you back and not you moving up and down, and only when you are in the facility, you are told there's no medication.
Okay, thank you so much for your time, and we do appreciate you coming to clarify certain issues. That is Madoda Sambatha, who's the Northwest Health MEC. Shocking story. I have absolutely no words how that was even allowed to happen in the first place.